Sorry.
Sorry. Thanks, Brooke. Ruthie?
Here.
Okay. I think we're missing Linda and John Balash. I'm going to read the script from remotely conducted open meetings. As a preliminary matter, this is Dorothy, Chair of the Contract Review Committee. Permit me to confirm that all members and persons anticipating the agenda are present can hear me. Members, when I call your name, please respond in the affirmative. Brooke Moore?
Yep.
Joanna Roach?
Here.
Bert?
Aye.
Ruthie?
I am here.
Okay, staff members, when I call your name, please respond in the affirmative. Jericho Mealy?
In attendance?
Ann Median?
Here.
Anticipated speakers, we will have none, so I'm not going to ask anybody to call their name. Good morning.
Dorothy, John just jumped in.
Oh, hi, John. John, can you just say your name? Maybe he did. Morning, John.
You're on mute, John, in case you're talking.
There we go.
Hi, John.
Hi, I was trying to unmute and it wouldn't unmute.
That's okay. We understand the computer thing.
I don't.
Me neither. Good morning. This is the open meeting of the Contract Review Committee is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020. Due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings. And as such, the governor's order suspends the requirement of the open meeting law to have all meetings in publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows public bodies to meet entirely remotely, so long as responsible public access is afforded so the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. The CRC meeting will feature no public comment today. For this meeting, for the CRC is conveying by video conference via the Zoom app as posted on the town website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care not to screen share your computer. Anything you broadcast may be captured by the recording. All supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. We are now turning to the first item on the agenda, but before we do so, please permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, the chair, will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, question, or motions. Please hold on until your name is called further. Please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that generates accurate minutes. For any response, please wait until the chair yields the floor to you and state the name before speaking. If members wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. After members have spoken, the chair will afford public comment, which is not in regards to us. Finally, each vote taken today in this meeting will be conducted by a roll call vote. Okay, thanks, guys. Can I get an approval of the agenda?
So moved.
Second.
Hi, Linda.
Hey.
Okay.
Ann, check your email from me.
Yes, I will.
No, not you, Ann.
Oh, okay. Sorry.
Okay, okay.
Bert Johnson,
Here. What do you want?
I'm not gonna tell you. Ruthie,
Yes.
Linda,
Clearly,
Aye.
Joanna,
Aye.
John?
Aye.
Okay. Guys, before we start our deliberations, there are a few things. We have sent out an email to the providers to see who might be available for follow-up conversation in the upcoming week. I have asked Anne to schedule meetings, final, 2 deliberations if we need them, and then a final approval of the report for these dates following. Sorry, and I'm gonna just pull up my email. Anne might be able to just answer the dates I gave her this morning. It would be skipping this week. And I am looking for the dates to have a meeting on either February 7th, 9th, and then a final meeting to go over the report on February 23rd. That gives me time to actually compose a a report.
Dorothy, can you just hold on? I'm just gonna send Linda something. So I'm gonna step away from my computer.
Yes, I will hold
what are
on.
you saying? What are you saying, Dorothy? 7, 9, and what?
7, 9, and then the 23rd, with hopes that next week will be used for people to meet with any of the interested bodies that are in the grant process, if they have questions for the on-site visits and on-site interviews. And I've requested that they be able to do those via either Zoom, phone, or in person.
So question, so you're saying the meeting schedule, because I just asked Ann this, the meeting schedule for Boston would be, for February would be the 7th, the 9th, and what date?
23rd?
That's the middle of school vacation, if anybody on here still has kids in school.
I thought school
No.
vacation started the 28th and
It's
went
the
to
next week, Linda.
Oh, that's right. It's the
the
beginning.
following week.
So I can't do the 7th, but I can do the 9th and the 23rd.
Okay,
I'm all
I'm
right,
okay
the
on-
7th and 9th and the 23rd.
excuse me?
I'm okay on the 7th, 9th, and the 23rd.
Okay,
As am I.
okay. Ruthie? We'll give her a second there.
It's, when I'm trying to check on the calendar and I'm on Zoom on my phone, it gets me off of the Zoom. So
That's-
it took a minute to get back to the Zoom and unmute myself. Yes, I was looking at the dates and that works for me.
Okay.
But it's mornings. It's mornings, right?
It is mornings, Ruthie, yes. It would be 10 o'clock.
Okay, yeah, that works for me.
Okay, Bert,
Yes,
that work for you?
so far.
John?
So far, it works for me.
Okay, fabulous.
And,
So-
and we're gonna get a reminder email, right?
Yes, you will, but first Anne has to get.
Okay, I'm sorry about that. Linda, did you get my email?
Hold on.
It's coming from the health department computer.
Yep. I got about 100 emails last night after not getting any afternoon yesterday. I'm still trying to get through them.
Yeah, so it won't have my name. It'll just have health.
Oh, no, didn't get that. Keep going with Dorothy. She's got to
Okay.
be here somewhere.
Okay, so everybody, that'll depend on Erica giving Anne the okay on those dates. We've requested them this morning. We'll see what those dates, whether those dates come back. You haven't heard, Anne, have you?
No, I was in another meeting, so I hadn't had a chance, but as soon as I'm finished here, I will email Erica about those meetings.
Okay, and then Anne is sending out a blanket email to all of the people, as I said, requesting dates and times. And what I'd like to know right now is who's interested in talking further with which organization, so that we can properly suit you to that organization. So I'm going to start with Bert. Anybody?
Small Friends.
Okay. And do you want to do that in person or
No, I'm down in Florida right now, so it's got to be by Zoom.
okay, awesome. Brooke?
I would be interested in talking to Martha's Vineyard Community Services if we feel the need for that. I am not sure that it's necessary. So I would love to go see Health Imperatives. I've never actually seen their facility.
You haven't?
No, because I
Oh.
joined this during COVID and
You need to see what amazing things they pull out of the building they pull it out of.
yeah.
Which one
And,
is that one?
Health
Health
imperative.
Imperatives.
Ah.
And same with a Safe Place. I've never actually been in their building.
Okay, well, that's the same scenario. So that would be good
Yep.
ones for you.
Yep.
Okay. Ruthie?
No, not really. No, not really.
What?
Okay. John Balash?
Well, I'm available by remote. I kind of can't navigate most of these places these days. In person, that is. I just can't walk. I can't get up and down stairs very easily.
Yeah, so is there anyone that we can call you in on or Zoom in
You
on?
can call me in on anyone you want to.
Okay, so when we're done, I'll see what's left and you and I will discuss.
Yeah, that's right. I'm available for just about anything you want.
Okay, that sounds great.
And in theory, if it's the right place and the weather's not bad, I can manage, but I can go about 25 yards on my own.
Oh, okay, well, Zoom and phone is just as great and we can do
Yeah.
it that way.
Whatever.
Okay. Joanna?
I'd like to go to Gosnold,
Hmm.
Okay,
and I think I'd also like to go to Fairwinds.
okay, great. Linda?
I'll do my usual Safe Place and AAN. And I don't care if you have to throw a third one in there. I don't care, Elder Services, one of the other ones.
Okay,
Because I've done every one of these. So whatever, but I really enjoy Artists Association and Safe Place.
okay. So
But
what's
I'll do
left is,
whatever's left.
okay. We have the food pantry left, so I guess I will do the food pantry. And Brooke, I'll probably go with you to Health Imperatives.
Okay.
And Joanna, I'll do Gosnold and Fairwinds with you.
Great.
And John, I'm gonna call you in to go to the food pantry with me.
Okay.
And I'll probably have you and Bert do Small Friends.
Okay.
Okay,
Done that before.
Whatever you need me to
And,
do other than that, I'm fine.
okay, legal, what did you say, Linda?
I'll do whatever's left with you.
Okay,
And I've done elder services.
oh, you have. Okay, let me get times and dates and see what we'll work out, okay?
All right, Ann, I did not get it. You're gonna have to resend it.
Okay, hold on. I'm stepping away again. Hold on.
Okay, so that's fabulous, guys.
Also, if you need someone else, I was thinking maybe I can do like via Zoom though, only like if it's morning, maybe with
Okay.
health imperative or anything with behavioral health, I'm interested in that and the elderly.
Okay.
But it would
So
have to be because I can't do in person. I have like a lot going on.
Okay, so what we'll do is, Ruthie, I'll look at it and give you, we can only have 2 people at a site. So, I will look at it and reach out to you with what's available. I'm gonna do Nantucket Cottage Hospital. Anybody else interested?
I could do that.
I don't think you should.
That can't be virtual.
No,
Oh,
but
well,
I don't think that you should do any, and Nantucket Cottage Hospital if you work there.
Yeah,
oh, okay.
Yep.
Okay, there's a conflict of interest involved in that.
Okay, no worries.
Okay,
I'll go with you, Dorothy.
okay. Fabulous, thanks, guys. So
And any other ones, if you need a second person, I mean, I'm happy to try to fit in. My calendar's pretty full, but I'm happy to try to fit in stuff.
Okay.
So,
okay, it looks like, I think we'll be okay. It looks like we've got them covered.
Mhm.
But once I get it in place, if I do, I will reach out.
okay.
Dorothy,
Yes,
the only time I can't do it that week of, I guess it's the Valentine's Day week, the 14th, is Tuesday at 10 o'clock. I have CPC at that point.
okay, but we're gonna try to schedule these meetings for next week, which wouldn't be the 14th.
Oh, okay. Oh, yeah, Wednesday at, I have Council on Aging on Wednesday at 1:30. So that's the only time I'm tied up next week.
Okay,
Yeah, Dorothy, I'll have to talk with you about my schedule as well.
yeah, if
Okay,
you,
well, I could fill in the mornings, early mornings, via Zoom only though. I can't go in person because I work a lot. So via Zoom is the best way for me.
All right, did Linda get that?
I think I have it all noted.
I got it.
Joanna, I will reach out to you once I find out from these people and we'll get a couple tentative times, okay?
Okay,
Okay. There are a couple of things that we would normally be deliberating today. I'm gonna request that we not discuss because I'm waiting on information. One of those is Fairwinds.
Can Bert put himself on mute?
I think it's Anne.
Yeah, I think it's the human service officer.
Okay.
Dorothy,
Yeah, Joanna.
I might, so it may be better if I tell you sometimes that I'm available. Just
Yes.
because I have a ton of standing meetings. So if you email me separately, I'll give you a list.
That sounds great.
Okay.
Yes, same for me, Dorothy. I have a pretty crazy schedule the next couple of weeks, so it would be helpful to try to bring things together. Sorry, it's just hard.
That's okay, guys. So what I'm gonna do is I'm gonna send out an email via Ann asking you all for what your schedules are. Okay?
Mhm.
And then we'll go from there.
That would be perfect. Yep,
Okay,
that would
fabulous.
be perfect.
So as I said, I am gonna table any discussion that we would have on Fairwinds because I'm waiting on information. Actually, a lot of these, I think there's some that we have a lot of information, a lot of questions that are still out there. I think there's a lot of, we didn't discuss, I'm gonna interview NAMI. I would love to have somebody come with me with NAMI. I think that we have to get a better understanding.
I will. I'll do that. It makes sense because they're connected to Gosnold.
Okay, fabulous. So I have some standing questions out there right now with NAMI and Fairwinds in regards to a better understand Gosnold and a better understanding. I don't think that a lot of the questions were answered or answered to us in a way that made some sense with where some of this money was going and how these programs were going to be running. And there were some things that have come up so that I've just sent out some requests. I feel that those big ticket items need a little bit more information behind them before we start discussing them. And I also think that the interview process is going to be very important. I think the interview process helps us a lot in our deliberations because I think there are times we come back with a better understanding as to where we really want these funds to go. when we start deliberating before these conversations, we go to the conversations, we come back, and there's this wealth of information we sometimes gather, which presented to the board in a different way, sometimes helps us better understand our funding and how we want to see the funding going. And it's really important as we go through this process. And I know that maybe I say this an awful lot. The human services mean an awful lot to me. This funding has an impact on thousands of our community members in so many different ways. And even though it might be what you might consider, or somebody might consider, a small budget, this 650,000 plus the extra 100,000, so the 750,000 are major impacts for every one of these private nonprofits. Because one of the greatest tools this gives them is when they go for grants anywhere else. If a municipality is giving you money in grants, you gain strength in your grant process. And so as we're going through this, I really need people to understand the whole financial means that the people are coming into us, the financial impact our grant has on them, and the impact it has within the community. And one of the hardest things that we ever have to do is take off the hat of what we believe and put on the hat of what is right for the tax dollars and for everybody in the community, not just ourselves. And this department, this program, this money, I've seen the impact it's made. I know the impact we make in giving this money. So I really need it to be that we understand that we're coming in it not with our personal beliefs at any point in time in this. It really has to be the knowledge brought forward to us that does it. We can question it. We should question it. That's the only way things happen. But we have to actually look at what's presented to us and what's the best benefit for our community. Okay. So I know that we have some that are really simple and really don't need a lot of discussion. And things like legal services, it's pretty clear what they do. It's pretty clear what they provide. There's not usually an in-depth, what is the impact on the whole human services by these programs, but it impacts so many people. And so we don't usually have to have an in-depth, we don't go back and meet with legal services. There's really not much more questions we have for them. But the others we do. And so with that being said, I would like to sort of maybe get a tentative feeling and then actually table deliberations on the funding today until after our meetings, unless there are questions people have that they want me to present to the different organizations in writing before meetings. And that way we could, so that there's answers for anybody that had questions right now as to in the way that they were thinking funding wise. How does that sound? I see Joanna.
I just have a question. So I'm wondering if we have like a sheet that is a cover sheet that shows the name of each, I'm sure this may exist and I just didn't print it out, the name of each organization, what they requested, what they got last year, and what our total amount of money to give away is, because that would be really helpful.
You actually did get it. And if you give me 1 minute, I'll tell you the exact date that you got that.
Awesome.
It was sent out by Ann per request of Linda. On December 16th.
Excellent. I will look it out. Look it up rather.
Dorothy?
Yes, Bert.
Yeah, the one I got just has the amount requested in the agencies. It doesn't look like the one we had last year where we put a separate column in for what they got last year and what,
Actually, she did do one, and there were two sent out on the 16th. It was the first one sent out on the 16th. And she has copy of CRC funding from past and request and funding. She did send both out.
Okay, I just would ask Ann if she could resend that to me.
Yeah,
Yeah,
I'll
okay.
send it out to everybody after the meeting.
Great, because that's a big help when we start deliberating.
Yes.
Yeah, it's huge. And it gives us a good idea. And she actually, I believe she sent out a blank one for us too. Well, this one's- but they're there.
Hang on a second. I have what she just sent me, which I don't think is right. And then I have what I have from before, as you just mentioned. The one that has the colored columns, 19, 20, 21, 22, doesn't have 23 on the same sheet. So I'll put that over here for a second. But what Ann just sent me just now, I don't think it's, what did Lepre come in under? What is he calling himself?
That's a different grant, Linda. That's the
That's a different
cannabis
grant, Linda.
I know, but I just thought I would see it on here somewhere.
No,
It's
because
under-
it's different grant money, so it's gonna have to come in on it. We've only done it once. It'll
Right.
come in on another sheet. This is just right now in front of you are the human service grants, not the marijuana tax
Okay.
supplements.
And Cape Mediation, I just had them in my head for a reason.
Mhm.
Where's that?
They did not apply.
Okay,
Remember?
because I have that on my old sheet, so I'm just trying to track over from last year to this year, just to make sure I
Yeah,
don't
so-
miss somebody.
So Cape Mediation, Gosnold, and the Civic League would not be participants in this grant this year on this one. They are, Gosnold is on the marijuana one,
On the marijuana one, which is, yes, which is what Lepre's under.
correct?
All right, can I get a sheet for just, for that one, so I have them all together?
Yep, we'll send one out with all three of them and with the three grants and how the proposals last year and who got awarded the money.
Yeah, and the money, and yeah, what we have left for this year. Okay,
And we have not gotten our total for that grant, the amount of money from the tax collection as of yet, correct?
Correct, but what in speaking with the chief financial officer, he told me that number can change, but what we should look at is $100,000.
okay,
As the
Okay,
marijuana total.
well, that's what we should be looking at. That number can change before the town meeting begins.
Just for historical information, I think last year, with only running for half the year and with one dispensary, it was 90 something, right? Is that what was it 94, 95?
It's
Oh,
gonna
wow.
be more than-
I think it was 93.7 or something.
Yeah.
it's gonna be
Um,
twice that this year.
Well, remember that COVID changed it. The other dispensary wasn't really in full function.
And they've been closed off and on
And it's
Yeah.
still
since they
not
opened.
function.
Yeah.
I still
So-
have a problem with the whole thing, but
So what we're gonna base it on is Jericho, he told me to base it on 100,000.
okay.
So that's what I'm gonna base this on, and if it's anything,
If
we can address that and amend it if it's different afterwards.
But we're
Yeah.
still capped at 650 for our usual yearly thing, correct?
I think it's 675 this year, but yeah, it's that
Oh, yay.
same chunk of money.
675 is 25,000
No,
more. than
no,
last
whoa,
year.
whoa. Jericho, until you get that in writing. can we-
Yeah.
That's guys, we're gonna stay at 650 until we actually get it,
Yeah, apologies.
Okay,
okay?
And I might very well have been incorrect in that number.
well, that makes a big difference because we're either 200,000 short or more.
Well,
Right.
we're gonna be short. We're gonna be short this year regardless.
Yeah, regardless, I just want to know where we've got any kind of room.
Right, but I think until we have that, we are sticking with the fact that it's 650 until we actually get official notification,
Okay,
okay? So with all this being said, everybody, I personally would feel a little bit, I would love it if there are questions anybody has for an organization that I should send out prior to their meeting with them. And then I would table the discussions on our deliberations until after those meetings.
I have one more question.
Sure.
Just about the money from Sandbar. How does that fit into this? Is that part of the 650?
No,
No.
and hey, Linda, let me explain this. We are to not look at that entity at all. That is a separate source of money given as a gift from the Sandbar to organizations And it is supposed to not be within our deliberations or our,
So they decide where it goes.
With the
they reach, to be honest with you, what happens is they reach out and to town, and I've been in the process of the request. They have asked me to go over with them different organizations. They give us the organizations that they would like to see funded. And we have had I've had, prior to Jericho, Rachel and I would have discussions in where the funding, what sources we saw had maybe lacked in funding, that needed funding, where the community might be in need. And
Do they have any idea this year yet where they're looking?
it was already given out.
Who got it?
I'm gonna look right now. I gave,
Because we knew last year.
yeah, but we're not supposed, but the problem is, and I have to remind everybody, the first year it was given out, we used that as a basis of our funding, and
Right.
we were scolded basically for doing that. It is not our job to do that. This is a separate entity, a separate gift, should not be looked at in the funding sources coming from our money in the CRC.
Right.
Okay,
I'm just interested as to who got it.
yeah,
Yeah,
I know.
I'd like to know too.
If you give me 1 minute. I believe that it could have been, and I am not 100%, so I'll reach out to Rachel in a minute and see if I can get an answer. I believe that we split it between Fairwinds and NAMI.
Really?
Well, the biggest key was the gentleman wanted to see it go to somewhere where mental health is being addressed. Those are the two organizations addressing mental health right now.
Yeah, I would have liked to have Lepre gotten it, but that's,
But Lepre, it's not mental health, but you can't decide where a gift goes when a gift
Oh,
is
I know.
given by an organization.
I'm just saying what's really happening right now in the trenches.
But Joanna,
Yeah.
I'm reaching out to Rachel, and once I get a complete answer, I will send it out via email to everybody.
Okay.
Okay,
Okay, thank you, Dorothy.
you're welcome. Is there any questions anybody has for an organization that should go out prior to their meeting with them? Anybody? Joanna?
I mean, so basically the other day when we were talking with Gosnold, I was still really unclear about what exactly, but that's part of the marijuana money. So I guess that doesn't really relate to this conversation. Or do you want to just focus on the list that's here? Because I have a second question for Fairwinds.
Okay, so
But
Joanna.
they might both have something to do with the marijuana money. This is the part where I get a little bit confused.
Okay, so we have two grants out. One is the human service money for Fairwinds, and one is the marijuana grant for Fairwinds. Any
So-
questions you have for Gosnold in any capacity, I will take, because I'm having they've asked to speak with me. So I'd be happy.
So I am confused about their presence on Nantucket, right? And their office and who works there and what programs they offer. Because if you go to their website, it's very unclear. It directs you to the Cape, and then it doesn't really say anything. And I tried to find that sober event they were having and to like research it, like who's teaching it, is it free, right? Like I was trying to find more information just about that, and it was hard to find.
We've had issues with
Okay,
Gosnold
hey,
for years.
Linda, let's hold on, please. Joanna, okay, go on, Joanna.
So that was my thing, like who exactly works there? What do they do? What clearly are they offering the people from Nantucket? Right? Like I was not clear on all of that. And I also don't understand their partnership with NAMI. And I think I said this already. The only reason at all that I'm concerned about the Gosnold piece, or one of the main reasons, is because they're a for-profit organization. And it doesn't seem like we should be giving tax dollars to for-profits.
They are not a for-profit, they are a 501c.
So what's,
Gosnold is a 501c,
C3?
C3. Yeah,
So they are a nonprofit.
they're a nonprofit.
Okay, because I didn't catch that from their website either.
It's in there.
I-
You have the paperwork in their Gosnold application. You can see the
Tax
the
filing.
paperwork.
Should be
I
the
just, I
tax
just felt
filing in
like,
the appendix.
Yeah, you can see their tax ID number
Yeah.
as a nonprofit.
but
Cover
are they,
critical
so
core.
here's the question. Are they using NAMI's nonprofit number? Is it lent to them?
Okay, so the program that we funded first off with the first marijuana was done through NAMI with the effort that NAMI helped get the program up and running and back on Nantucket.
Mhm.
And then Gosnold is taking it over on its own program.
But then nothing really happened
It's supposed to start February 1st
of this year.
of this year.
All right. But like, I'm not clear on what exactly the program is and who's executing it. This one guy who's traveling back and forth on the ferry?
Well, no, I think he's gonna be running it with the support of, in the office of 2 members of NAMI, because NAMI will be moving into that office
Okay.
and able to answer the phones to help him at any point in time. They'll have from what I understand, and these are questions, Joanna, just so you know, they're the same, you're asking the same questions I've asked, and I'm sitting down with a meeting today with them.
Okay, well, that's very good news.
Yeah, right? Um,
We're on the same page.
We're on
Like,
the
I just don't get operationally how that works, right? And I don't, based on the fact that they haven't been able to successfully execute this, I'm nervous about giving them money. I'm certainly not saying that their program doesn't have value or any of those things, right? Now I'm going to go over to the Fairwinds part of it. So we got that whole listing of all the positions for Fairwinds, right?
Mhm.
And I thought that, and this is where I got confused about the money, the marijuana money and their program for that grant and their regular operations, because didn't Christie say during the call that they were ready and prepared to hire these soap people, right? But on that list of positions, like, they didn't show like 3 open positions for soap and potential funding. Like, it wasn't even on the list. So are those people going to be part of their staff? Are they going to be able to staff up quickly? Like, I was trying to just understand again, because I do think this mental health thing is significant in our community. And what is the quickest and most efficient way that we can deploy resources through this money pool? Right. So that's kind of the lens at which I'm looking at this. And so because Fairwinds seems like they have at least, I was going to say a well-oiled machine, but I'll say a machine, right? That has people and offices and staffing and an infrastructure that's already working, right? It seems like that's a better funding choice because the likelihood of execution and success is greater, right? I think the risk in terms of making an investment, the risk in going with a Gosnold investment is that they don't have the same infrastructure, the same track record, or the same well-oiled machine, especially if we're talking about the fact that the program that we funded for last year isn't starting till February 1st, and they're only just getting people in the office to answer the phone. Like, Fairwinds has been here, they're doing this. So I think in terms of community impact and the way we spend the money, and I'm not saying that some of these other organizations don't have also very viable needs, and I can get to some other questions about those that I have, but that's just my initial take, and I could be wrong, but this is why I volunteered to go talk to those organizations.
Okay, I think that's great. I want to clarify that the Fairwinds is not doing the SOAP program. They are doing peer recovery.
Okay, peer recovery coaches, that's it. I messed up the term. Yeah, I got it.
It's a different program, so I think that is extremely important. I think and Linda, I'll get to you in a minute. I saw that Brooke had her hand up, so let me finish and then I'll go to Brooke, and then Linda, I'll go to you. I feel that we do have to get the answers. To be honest with you, over the years, I would not say anybody is a well-oiled organization dealing with mental health.
I understand.
And I don't mean that in a mean way, but we've seen, we have witnessed a lot of maybe good changes at Fairwinds, but we've also noticed, there's still a lot to be learned. And the one thing that, we all should keep in mind is we do have to, and I agree, we have to know what's going on with Gosnold. but there is nobody stronger in the eastern coast of Massachusetts dealing with substance abuse and mental health than Gosnell. Nobody. So I think that we really have to look at the connection it has with everybody, the programs it has, and what both the programs actually deal with. It is very easy to say that you've got a great mental health program, but if you don't have some of the resources to get people with addiction into the proper therapeutic, and that's one of my concerns, you know, they came up with Tim Lepre. I think his program is fabulous. It's the therapeutic end of all of these that really make a big difference in the long-term recovery
Yes.
and
Yes.
sources available to the people in addiction. So
Yes.
they're great questions and they're all on my list. So I
Good.
will send it out. Before I send it out, Joanna, I will actually send it via Ann to you so that if you want to add to it, you may add to it.
Okay.
Okay.
And then the other organization that I had a question about was the Interfaith and
Okay.
the food pantry, right? My question there is that enough money? Right?
Never.
Should they have asked us for more money? I'm very concerned about this.
So the Interfaith Council, what we are not doing the food part of it. We do not help with the food part. We help with the administration at the food pantry. I think that over the years, they have a good funding source. And there's been a little bit of questioning over whether or not they have needed more money. It has not been presented. Let's say that they would do better with a better presentation to us.
Yes, I understand that. I mean,
Okay.
I guess the reason I asked this question is because, and correct me because you guys have all been doing this for longer than I have. The woman who is the head of it is obviously is leaving and retiring. And if we're supporting the administrator, is she replaceable? I guess that's the concern that I have. And how can we support making sure that there's a good replacement for her?
Okay, so
She's not leaving
I'm gonna-
anytime soon,
Linda,
let's just
Linda,
say.
Linda,
She's
hold
fine.
on. I'm gonna go back to answer that in through some questionings that went with my meeting with the Interfaith Council in regards to the food pantry.
Okay,
They are actually looking for a replacement for Janice at the present moment. They are actively looking. Janice will be leaving the Interfaith Council within the year. It is a move to actually hopefully strengthen the Interfaith Council and the food pantry. There have been numerous concerns within the community, within different facets of the community as to whether or not management has been able to change with the demographic of the island changing so much. And whether they've been able to meet the needs of it, to understand it, whether they're tech savvy, whether they can look at the bigger picture, whether, and because of concerns that way, the Interfaith Council is actively looking right now for a replacement, and their hope is to have it done within the year.
okay. I mean, I guess you've identified my concern. And I think the other piece of this is that, and this won't come as a surprise, I think, to any of you, the hiring environment on Nantucket right now is incredibly challenging because nobody can find housing. And if they can, they can't afford it. So replacing anybody in any position across all organizations, especially nonprofits, is virtually impossible.
Right.
Right. So I worry that the person for this doesn't exist, right?
I think that they're going to look at doing it as not maybe one entity running, over doing all the different things, but maybe somebody running the rental assistance, maybe somebody doing more and getting more people involved in the fuel assistance and doing the food pantry itself. They have a behavioral task force, interfaith task force that has been working diligently on this. And I think that they have a much better picture of what is needed than they had maybe a year ago. And so I think they're really working at it. They have some good sources within them, within the body that they have. They have some good staff. The staff needs to be believed in, and the staff needs to be nurtured. And they would do, you'd be surprised at where they could go. So, but yes, I
Okay.
think it's
And then I just have one last question, and then somebody else can move on from me. Is what is the temperature is the wrong word. What is the pace at which these places, or the willingness for these places to collaborate with each other?
oh, sorry. I didn't mean to laugh. I'm sorry. What is
I
upsetting?
laughed, I laughed as well, Dorothy.
Okay, thank you.
We ask this
Sorry,
every
I'm
time.
new.
So I think the problem is, we hear when they present to us that they collaborate. And this will be the key thing that you will see on the interview process. When you really ask the questions, they do not collaborate. What is
That was my concern.
Yes. What has been very upsetting is Health Imperative sits in the same building as Fairwinds, and they have the worst problem trying to get Fairwinds to collaborate and work with them. It has been horrendous for years. They can't get it. They're in the same building. The Safe Place, Health
They do.
Imperatives have a phenomenal, and they've been working with NAMI and ASAP. They have a great working rapport, and the three of them actually did the community service. They work with the Nantucket Resource Center. They actually have a great collaboration going. And they've worked on it really hard. So what's interesting is people come in and they say, yeah, we collaborate. Part of the issue is the people that have been able to look beyond the dollar signs that come with collaboration. And I don't mean that in a mean way, but people think that it's going to hurt them.
Mhm.
Instead of realizing that in great collaboration, there's some phenomenal grants out there. If they actually were actually more of a collaborative, there are so many phenomenal community grants available to them. And by doing so, they only enhance their programs. You know, up until we're not doing social services anymore, but for years, elder services and the social service department at the hospital were the best collaborators on the island. And then it came to a dead stop.
Right.
And,
Can I-
and
I
so
just
that's,
have-
yes.
I have one more comment about that, so the collaboration piece. So through maybe the community foundation, right? Could this group make it a requirement maybe that to
No.
apply for these grants, you have to go through some kind of team building exercise,
No,
right? Or some sort of introductory session where principles of collaboration were taught? Because it's, we can't do stuff like that.
no,
I'm
we
gonna
can
let-
suggest it.
Linda, I'm gonna let Jericho answer that. I think that as a town employee, he should answer that question.
So Linda is largely correct. There is no active mechanism by which we can compel them to do team building exercises, but I do have a couple of plans for including either participation in our directory of care process, and then some degree of interoperability between our data sharing platforms, as well as the new behavioral health leadership group is going to have shared data platform as a fundamental component of what they're planning on doing. I don't think we will be able to compel team building activities, but I am planning on building in at least the framework for data sharing and group activities and group kind of shared information to work with. And then hopefully as this state roadmap comes out in the next year or two, they will be mandating a certain degree of participation and data sharing on that front as well. So I can't get them to do trust falls, but I can get them to use the same data platform.
Okay.
Jericho, is there a way, I mean, we've made changes in contracts and, we have it in there that they have to show us collaboration within their grant.
Yeah.
Is there a way in the actual contract that
So
that in awarding the contract, it is expected that you will, there will be, maybe there is, And two meetings a
no.
year that you have to attend with collaboration with the, like to get them at least starting to talk.
You
I
can
don't-
suggest, you cannot
Use-
compel.
I'm just asking, I'm asking Jericho to look into this, in whether or not, because we've added things into our contracts.
I think that would need to go to legal first.
Yeah.
I'm not a contract law person, thank the Lord. But I do know that we could, that is something we can potentially do. And then what we would do it would be like essentially a training for working with the town would be how we do it. So that we get everybody, like everyone who gets a grant from us goes to like 1 4-hour session so that they all fill out their quarterly reports the same, et cetera, et cetera, et cetera. And then from there, I think we could spin that out into like more active collaboration. But there is significant resistance from the providers to do this. And I do not know if contract is the best way to do it, or if like we can kind of give them the tools to collaborate and then have them start doing it themselves. Like there needs to be an internal incentive as well, like a carrot and a stick, basically.
Yeah, but it sometimes isn't the carrot, the carrot's the money, right?
Yeah, but I think that we can say that, but we also probably cannot not fund Fairwinds for a year because they're not sharing, like in a practical matter. But I do think that like we can definitely work. That is something I'll explore with town admin, and then I'll start looking into actual mechanics for what that would look like. But we have to be very careful to figure out what metrics for collaboration we want. If it's participation in like a 4-hour information setting, that's fine. But if we say you must collaborate, and they're like, we sent 10 emails and we're collaborating, I don't know how to find metrics for collaboration that would be easily
Quantifiable.
yeah, or put into a contract effectively. Like they might try to collaborate and the collaborative process might fail and that might not pass our test. So it's something to look into and something that we should as a group, as a committee, discuss a couple of times, I think.
Yeah, okay. I mean, I think anything that we can do to encourage that is worthy.
I mean, for specifically behavioral health stuff, probably like the number 2 thing besides like the cost of living, the locally relevant cost of living stuff, the number 2 thing that everybody put up as a gap and a failure is lack of collaboration, even when it comes to like information and shared data. Like, so I think if we build shared data and then that will sort of start us in that direction. But I do think the idea of like a leadership or a town grant meeting type thing where we get a stakeholder from each of the grant funding things together, I think is a good idea to start with. And I'll raise that up with CRC and with legal. Oh, sorry, with admin and legal.
Okay,
Okay,
thank
thank
you.
you, Jericho. So if you could just look into that and let us know, that would be awesome. Okay, Joanna, anything else?
No, and thank you for humoring me with all my questions.
No, it's fabulous. This is what we're about. We have to ask the questions in order to make good decisions here.
Thank
Bert, you have anything?
No, I just like Joanna's comment about can't we get them to collaborate with one another? We've
Yeah.
been trying to do that for all the years I've been on the committee.
Yeah,
Well, I
it
guess
might,
I caught on quickly.
it might be good that there's a tool that sort of brings them down some kind of road.
Yeah.
Yeah.
Okay, John?
Well, I think the prior discussion covers anything that I would have tried to bring up, so I'll pass.
Okay, fabulous. Linda?
I'm irritated, but I'll move on. The Gosnold is a good question because they've been here, they've not been here. They've been here, they've not been here. They've said they're here, they're not here. Remember that 2 or 3 years ago, we had that issue. It's just, I don't trust them. They may be the greatest thing on the planet for what they do, but I don't trust them here. So I'm having a big struggle with a Gosnold at the moment.
Okay,
Because they may pull out again, or they may say they have an office and nobody's there. and they may not be completely accessible by Nantucket residents. So we've had this issue with them for some time. So I don't know if they're really committed to being over here, because you remember, Dorothy, maybe 4 or 5 years ago, maybe now, they said that they were here, they were opening the office, they were going to have it staffed. We met the 2 girls that were over here. Then all of a sudden they're not.
Yeah, well,
And, so
they
I'm just
actually-
having issues with that. Those are my questions. I don't know if they're committed again for 2 weeks, or they're committed permanently, or what they're doing.
Okay, just to clarify, they did open up an office here. They did have full-time staff. The staff was amazing.
Those girls were great.
The staff worked for a little over 1.5 years there before the director got engaged and her husband to be moved to the Bahamas, so she followed suit. And we have had concerns back and forth over whether or not they were going to be here or not. As much as I'm saying to everybody right now, I really want to see what they have to answer for me. I want answers to these questions. I have concerns just like everybody else. I was probably their biggest advocate with the town to try to get them open, because I understand the impact of the programs they have and the value to the programs they have. And I have been their biggest person writing emails being like, what the heck, what's going on? All the way to the CEO of Gosnold, out of disappointment for what has or has not happened. I would like to see what happens with this program. I have questions. I think we need solid answers and as much guarantee of a program that they can give us, and what that program will give back to the community if they get the funding for the program.
Yeah, but are they going to
I
be
understand.
accessible? Are they going to be committed?
Well,
They
the
weren't accessible.
accessibility, we already know the accessibility, Linda, will be, they're telling us that they will have somebody here 3 days a week. They run a program every Monday through telehealth, which they told us they have 13 people that are involved in that one. They run therapeutic. They're seeing 140 clients on Nantucket through teletherapy right now. And they do run the emergency. They are the emergency health provider at the ER. So mental health provider on the island. They have the DPH contract. Am I correct?
Yeah.
Or Department of Mental Health, DMH. So I understand the concerns, and believe me, I've already been going back and forth with Ally over this. And I want the answers to be there. I just think we also have to be careful not to put all of our eggs in one basket, and in a basket that has not provided for us what it has said it would do for years. They've made some changes, they've done some good things, but when you put your egg in one basket, it's just not good medicine. It's never good medicine in any way, shape, or form. And so I think we have to really have a much better idea of what's going on. Just like with Tim Leprey's program, it's wonderful, but one of the biggest components of the Suboxone program and those programs is the therapeutic end of the program. And you can't, as he said, people need help. Well, what is the therapeutic end of this program that's being run if there isn't that support? Because in reality, yes, some people can stay on it till they're 65. If you read and do your research on these 2 drugs, which I asked him to send to Ian, Suboxone, you're not supposed to be on a long period of time.
Right.
And you are supposed to take therapeutic care. People do sell off their Suboxone for stuff. So it is like any program out there, they're all very hard to monitor. They're all very hard to understand. And we're not in the trenches. We might know what it's like to have somebody that has to go through it, but we're not the ones providing the services. So I think that with all of them, there's questions about when you give the funding, is the funding actually funding to the best interest and, to the best interest of the community members and the best use of those dollars for the community.
Well, you're
So
trying to get a positive result from all of these things, have to have a positive impact, a positive result. And
Right, and it's
not
key.
continuing on and on and on and on and on, and not actually getting to that part, that, you know, the rainbow, the pot of the gold at the end of the rainbow. So,
Correct, but in any, you know, and I say this, and I don't know, in any therapeutic or any program like this, it's key to remember, sometimes we want to see numbers, sometimes we want to see, oh, they serviced, you know, they had 2,000 so-and-so hours. In those 2,000 so-and-so hours, what was the end result in the program? Did the people get from that service what they actually needed?
yeah,
And I know it's funny, but you can fund something, and in actuality, and I'm not saying this in our dollars, but if you can change the life of one person, you're gonna change the life of 100. And you have to really be careful that when we do this, we're looking at that the people are getting the right long-term services needed to change those 100 when we hit the 1.
well, are they being served? And what's the biggest bang for the buck to service the most people in the most positive way? That's pretty much what we are here for.
Well, not the biggest bang for the most positive, it's how much the biggest impact the program has.
Yeah, are they
Not
impacting
maybe-
enough people?
Not necessarily the number of people, but the biggest impact it has within the program that it's doing. I
I'm
mean,
not a numbers person as far as how many. I just want to know that they are doing what they say they're doing. And I want to make sure that they're committed to doing what they say they're doing. I just don't trust Gosnold over here.
Well, and I'm not saying that you shouldn't have that, you know, I think that they've given us reasons to have questions. Okay, I'm gonna go on to Ruthie, Brooke.
Yeah, I have a few questions. I have wrapped my head this year around this question of whether a program participates in insurance or not. And I really struggle with subsidizing care that is reimbursable through insurance, but the program does not or will not participate in insurance programs to get that money back. And I heard a very vague answer from Gosnold about that when I asked that question. Well, we'll think about that next year. Well,
Yeah.
That's a problem. And I think in light of the fact that we spend a lot of time grilling Fairwinds about their infrastructure and what they spend on administrative costs, that they have that administrative infrastructure because they are participating in a complex insurance environment and soliciting those reimbursements. So I just want to make sure we're asking these different programs for the same thing, or we're expecting the same things from each of them, and being as fair in that as possible. And on that note, I want to ask, I know we've had this issue about getting salaries from Fairwinds, and I want to ask specifically, at what level of a grant are we requiring that an organization submit the salary levels for their staff?
Over
If I may?
$25,000.
Okay, so have we asked for that from the Cottage Hospital? Have
Hold
we
on.
asked for that from Gosnold? Have we asked for that from NAMI? Have we asked for that from everyone else that's asking for over $25,000? I just want to be clear that we're holding everybody to the same standard. And I just want to reinforce this question about, look, it's hard to participate in insurance programs. It takes a lot of work, but I'm not sure we should be funding things that would be covered by insurance if they did. And then my other comment about Gosnold is, I mean, they've structured a program that depends so heavily on our grant that it looks to me like if we don't fully fund, the program doesn't happen.
Yeah,
And I have a real problem with their commitment to the sustainability of that program when that's the financial model that they've created. including, by the way, and I asked this question, taking a year's worth of a grant and spending it in 6 months, potentially from last year. And like, that's a problem to me, because like there's an incentive to delay implementation, because, hey, if I only run it for 6 months, I get twice the money to run it for those 6 months. And I don't know how we address that. I'm not saying that's what they did. I know they had difficulty getting this thing off the ground, but certainly being able to sort of spend it all in the latter half of the year is a disincentive to get moving quickly on some level. So that's kind of where I'm at in terms of the equitable expectations across programming.
Okay, I think that they did say, Gosnell did say, and I would have to go back over things, that they do apply for insurance when it is appropriate.
That is not what they said when I asked that question.
Okay, I thought it was asked a couple of times, so that'll be a question I'm gonna ask again.
Great.
Okay,
Thanks.
you're welcome. And I know that the program, they're thinking that the program will cost them about $150,000 to run here.
Mhm.
What happens if they don't get it? Do they stop the program? They don't do it?
Right.
Well, they said that they're pursuing grants. We don't know that. As a private nonprofit, they're, like, just like the peer counseling program won't happen at Fairwinds. One person told us it would happen even if they didn't get the money, and another said, if we don't get the money, we can't run the program.
Well, that's a pretty big question for Gosnold right now. If they don't
think
get
it's
the
for
funding, are they going to run it anyway? And then their commitment is out the door again. So
But I
I
think-
just want to know that. If they're committed to Nantucket, then stay committed to Nantucket, whether they get the grant from us or not. That's the question I want to know.
I understand, Linda, I understand where you're coming from. I'm just saying that in both programs, they both spoke about how in order to run the programs, they would need the funding. So, just so we're clear on that, I've added that question to your thing, and Brooke, I'm gonna be happy to get that in, and I'll get it back in writing on the insurance part with Gosnold.
And
For
if
you.
I may, also for the NAMI therapist reimbursement program, that's a really important question to me.
Okay, on the insurance.
Yeah.
Okay, but they told us they're doing it, and they're doing it on sliding scale. But we
Yeah.
will, I think we got an answer on that for you, but I will ask that again.
Okay.
Okay,
All right. So if they're not participating in insurance, it means that money is potentially being left on the table. That
If they
we're
qualify
subsidizing
for
something that would be
insurance.
covered by insurance.
but some of the people, it depends on whether they're qualified. So they're asking us for sliding scale for individuals who need mental health, who are not insured,
Yeah.
or their insurance does not cover it. NAMI is asking for the same kind of program that is done via Fairwinds, but on a private sector. I actually talked to one of the clinicians the other day, very briefly, that is actually in the program, but they do, if available, they ask for insurance. The sliding scale covers also patients that are not covered but need mental health.
So I would feel more comfortable if we had a written policy, if we fund this NAMI program, if they had a written policy for their therapists on how to determine who's eligible for what in the program. And frankly, I don't have a lot of confidence that private therapists are doing a lot in the insurance space at all, and even asking that question. Because I know this field a lot, and people leave agency practice because they get tired of dealing with the insurance rigmarole, and they do it as a way not to have to deal with insurance. And I am quite sure there are very few private therapists on Nantucket who are participating on insurance panels other than providing bills to their clients to submit for reimbursement. And that becomes blind to this system. We have no idea whether that we are subsidizing a therapy appointment for someone who then submits a bill to their insurance company and gets reimbursed for it. I don't want to create barriers to therapy, but I also don't want to be spending dollars twice for the same therapeutic hour.
Okay, I'm gonna just say something, and I would want to make this really clear. I do not think that we should make a blanket statement in regards to what therapists are or are not doing. If we
Correct.
do have it in front of us, that's
Okay.
a blanket statement as an coming out of us, that we do not know the business practice of all the therapists on the island. So we can make a general state that it's of concern, do they or do they not, but not say
Right.
that they left agencies and are not doing that. I think that's
Yeah.
just a
So I
blanket.
guess the way I would put it is, I think it's something we need to know if we're subsidizing their practice.
But Brooke,
Yeah.
Yeah,
we have the same problem at the food pantry. We have people for years, we've had people that I know go in there and get food, and they really are doing better off than the rest of us. Driving brand new cars. We just can't go past that point. But we know that there's gonna be people who abuse the system. Sure, there's probably someone out there that got reimbursed from their own insurance company and never told Fairwinds. And the same thing at the food pantry. People who get food that probably don't deserve it, that could afford to buy it themselves and take it so someone else can't use it. But that's just the best part of the problem.
I understand what you're saying, but if you create a system that doesn't have any checks and balances to begin with, it's not about someone taking advantage of the system. It's a system that isn't fully transparent on the financial side. Is my point.
I believe they've hired someone that their whole job is just insurance reimbursement.
yes, we
That's-
may do that.
Excuse me, Bert, that's Fairwind. She's speaking about NAMI's
Oh.
policy where they have this therapeutic care that's going on with the private non-sector. There's also I think it's important to realize there are a lot of people that do not want to be, that want the ability to seek outside of the clinical Fairwinds clinical services, that can't afford mental health. And then it's important to also remember that even though Fairwinds might have a sliding scale and insurance, there are people that fall through the cracks there too that don't get the services, or because of insurance, their sessions are cut because insurance and reimbursement only allows this. And I think it's just a very, very touchy thing. I think we can ask what the protocol is. One of the biggest things we cannot do is tell an organization how to run their business.
That's right.
That is not our job. We are not allowed to do that. We are allowed to ask what the policy is. We are allowed to say that we would support a policy that took care of this or that. But micromanaging any of these organizations, we are not allowed to do. That was made very clear to all of us a few years ago, when we made suggestions actually to Fairwinds about getting a chief financial officer because of their finances. And we were told you can make recommendations, but you cannot hold on anything because you don't like the way they run their business. It's about what their services they give provides, not by the day-to-day operations on how they get there. So it's a very tricky, and I just want to, everybody to remember that. I want to give, if you don't have any more questions, Brooke, I would like to go to Ruthie because I realize that we're at 11:30 almost already. So Brooke, do you have any other questions?
No, that's it. I just want to try to be equitable across the systems in terms of the expectations we have for these different grants and financial transparency. That's my point.
Okay. Thank you. Ruthie?
You still here?
Well, she might be.
Yes.
We're going to give her a second. Hi, Ruthie.
Hello.
Hi.
Hello, can you hear me?
It's pretty quiet, Ruthie.
Hello, can you hear me?
I
Sure.
can hear you. Can you hear me?
Yes, I was talking, but for some reason it was off of mute and I was talking, but you guys couldn't hear me.
That's because your voice is so low right now. It's very difficult for us to hear it.
Oh, I'm sorry, and I'm on the highest volume. Can you hear me still? Or
No,
more-
it's actually, I can hear you. I'm not sure if anybody else can. Can everybody else hear Ruthie?
I
I
can
can
hear
hear.
nobody who says anything.
I can barely hear her.
So Ruthie, I'm afraid your voice might not get recorded properly.
Oh, okay.
But we'll go for it, and everybody else will keep quiet as you go and say what you have to say.
I was just saying that my questions were asked by Joanna and Brooke. It was pretty much just all across the board financial transparency that I wanted to find out about, and the fairness of, health, the patients having insurance. When Gosno didn't really respond to them having accepting insurance, that was the big issue for me, for the behavioral health patients. I think that was a major that's actually a major concern for me. um so I would like to ask those questions also with Gosnode not being able to not being transparent with staffing. They gave staffing, but I just feel like there should be more questions asked with who's going to be here, if they're going to be here, and then with them saying they're having people come in 3 times a week. What about the weather? The weather is very unpredictable. And I just think people.
Ruthie, are you there? I think we lost Ruthie. Let's give her a second.
Oh, you guys.
She's in an area where she's got bad reception, I think.
Here we go. Hi, Ruthie.
Yes.
I'm sorry.
I can,
Yeah, I just felt like Gosno are with the insurance for people who have mental health. I think is very important with insurance, and also with them coming in 3 times a week. The weather is unpredictable. You know what I mean? And with staff, that's just a major concern for me. Um, with staffing and all across the board with health insurance being available to mental health patients. Not only Gosno, but everyone else.
Okay. Okay, is that it, Ruthie?
Yes.
Okay, thank you. Hey, Ruthie, I'm gonna just make a comment, and that would be that I would really love it if you could reach out so I could actually go over with you some of the presentations that occurred when you were unable to attend our meetings. And sort of go over what the presentations were, what the requests were, what the organizations are about, so that you can, in case you have any other questions or concerns, I'll be able to help you answer those. And then I think maybe Jericho and I could be available to help you in any of that circumstance. I'm not sure. I'm not sure she got me.
Dorothy,
Yeah,
if I might, our meeting recordings are available on the town's YouTube page.
yeah,
So-
they're on the
Auction.
They are, but I think that the other part is that for 2 years, we've sort of had little discussions, and I think you've had 2 years. Joanna's been on FinCom. I think it's maybe, and seen a little bit of the presentations. I think it's nice that Ruthie, if she has questions, that we are able to answer them, personally to her.
I just had, Dorothy, I have one more comment about Gosnold. Oh, we're on it. I'm looking at the list. And other than the Artists Association, I don't think we're sole source funding any of these. Gosnold is asking us to sole source funding a program that they said won't happen unless we sole source fund it. And that is a concern to me.
We do so, I think we,
We're part
Yeah.
of, we're
Wait,
part of
oh.
other things here. Everybody else is getting money from everywhere else in conjunction with ours, except for that Artists Association program.
okay, the Artists Association program, the peer recovery program would not run if they did not have our money.
The full funding. I mean, I'm saying we are totally,
Full
course.
funding, because they said that they don't have the funding right now to run that program.
and that's been on and off for quite a while on that one.
Okay, well, it's the same, we have to, as said, we have to hold everybody to the same standards. And one of the biggest things, the contract review committee funding initially was set up for, was for new programs, not sustainable programs. It was to fund new programs and get them started in the first 3 years of their existence. It was not to fund programs for 20 years or 10 years. So
Yep.
that everybody knows that anybody that comes into us with a new project should be looked at first and foremost, because that is the original funding of this money. So when Artists Association came into us, it was new and it was important, and it hit a variable there. And we looked at other organizations and we said, well, we're not funding all these other organizations to this because another organization's come in and it's got a great program that's providing services. The initial contract review committee money was set up for that. It was not set up to be sustainable income for all of these. It's become it. We understand the importance of it, but we cannot shut our doors and say, hey, we can't fund this new program for 1 year because where are they going to be next year? That's how all these programs started, guys. They all started on the same way. I think we all are very upset about the, how do I want to say this? The inconsistency of Gosnold. What we want is consistency. We want to know when we fund something, we're going to have consistency.
Or they're actually going to do it. That's my point. And
Well,
not
that's
how everybody
consistency.
started and not how everybody keeps going and coming back to the well like NCH. My point is, Gosnold doesn't have a backup plan. Gosnold doesn't have grants for this program. Gosnold hasn't done anything to help themselves with this program. Most of these other guys go after grants. They have help from somebody else, la, 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 you know, on and on and on, which makes me even more skeptical of Gosnold's commitment. That's what all I'm saying. Not how everybody started, not that they're coming back year after year after year, which they all are. But Gosnold is where I'm having the biggest problem.
But every one of these programs, in order to get their money, had to start with our grant money to then have the availability to say, hey, I can, you know, a town believes in me, I can get a grant. So I
True,
think,
but they didn't do it. That's my point. I'm
Well,
very
we don't-
skeptical. So you can keep telling me this.
well, this is the first
not
time
gonna
they've come, this is, okay, so they're still in the first year of any money Gosnold's ever gotten through any entity from the town of Nantucket. They
Right.
are still in their first year. They have never, ever, ever been in the grant process before. This money they got in collaboration with NAMI. And so we are still in that first year. So until the first year is over, even though we're all disappointed, and some of us clearly are very, very disappointed about it, we really don't have a basis to say whether or not the program they're doing is going to be, you know, viable. We don't know that.
I'm
And
not
so
asking
I
for
think-
viability. I'm asking because of their track record here, promising to be here, promising, and I do agree with what she said earlier about weather, because we brought that up with them, you know, 3 or 4 years ago. What about the weather? How can you get over here? La, 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 la. You can do teleconferencing. Okay, you promise you're going to do that. Yes, we're going to do that. That didn't happen. So I'm just saying,
So
you have to
two
really
things
look
real
at
quick here.
Gosnold's commitment to actually going forward with this program.
I'm gonna let Jericho.
So two things here. The point of these grants, I think, is to give funding to get a ball rolling. They are late rolling the ball, but they have not missed, like, they said they were going to do services in the first year of the contract. They still have time left on that. And if we can get them over the initial hump to do a program, then that is something I think we should, I'm fine with full funding a program that otherwise wouldn't go forward. But the other thing that we need to figure out is like, how are we going to gauge their commitment to this particular program? Like, what mechanisms can we, like, because it would be a bad thing if we didn't fund a program that didn't go forward, that provided a needed service on the island. But at the same time, like, how do we, like, we're going to sign a contract with them if they're not going to complete what they're contracted to do? Like, how are we going to compel them past that? I just don't know how we would gauge that, how we would operationalize measuring their commitment on this.
Quarterly reports, I gather.
I mean, that's what they're already doing.
Yeah, that doesn't mean they did it.
Yeah, but I'm like, as a regulatory board from us, we can ask them, are you committed to this program? But beyond that, there is no mechanism besides, like finding them in breach of contract. So, I mean, I think that we need to be very strict with them and be like, we need you to do this because you said you would do this. And then not doing this will negatively impact your ability to come to us for a grant again later. But if we also nix this program before it even gets started and don't get them funded again afterwards, we end up in a situation where we've made the problem that we are trying to avoid. Like we can't get money to start this program up, but if we full fund your program, we don't want to give you the money to get the product started. So we're eating our own tail here.
Well, those are my questions for them. Are they committed to this program? What happens here?
Okay. I'm gonna go to Brooke.
Just quickly, Dorothy, in regards to the question of whether these programs will be started or implemented if they're not fully funded. I mean, each of the cannabis grant applications have asked for all of the money. So I clearly that's not going to happen. So I would like to ask Fairwinds, because I believe we may have heard something different, you and I, in terms of what they said. So I would like specifically to ask them, would they do a smaller start if they got partial funding?
We will ask it.
Yeah, and I did
Thanks.
ask that question a few times myself of these guys.
I mean, I
Okay.
think we should absolutely very strongly be like, you guys got to get this going because we gave you a bunch of money to do it. But I think that full funding or not, if we can get someone over the initial hump to get a program that will then be more sustainable in the long run, then I think that's exactly what these kind of grants do. It lets the grant requester have a much closer relationship with the people giving the money out, so that there's more contextual knowledge of what's going to happen or what's not going to happen.
Well, plus when we do CPC grants, we always ask that question of every single person coming in the door. We've given away, $100 million in the last 16 years. We ask this question, what happens if we can't give you the full funding? Because we usually get like $7 or $8 million worth of requests. And they all said they'll take whatever they can get. And what has happened in the past is that when the town, whether it's CRC or CPC, shows a support for an entity, they can use that and leverage that on getting grants from other places, because it clearly shows the town is invested in whatever program it happens to be. And they have all said that that's a very positive thing to tell potential donors and other grant entities. So there is some to that also.
Okay. Okay, if there's any other questions from anybody?
Oh, yeah, that just takes me back to what I was just saying on Gosnold. Are they looking for any other people to donate to this program, or looking for grants for this program, or anything else going on in Nantucket? I didn't get that from them.
Yeah, they said they were in the process right now of actively pursuing grants to cover the additional costs this program would be. They did say that.
We'll see if they do it.
So clearly, everybody, this is the most important reason I want everybody to get as much information as possible. There are clearly some very, very strong personal feelings about some of these organizations. So I think it's really important that we have all the answers to everybody's questions in front of us. So, and if need be, after you receive the answers to the questions, that is the reason we have 2 dates for deliberation. In case you want somebody to come back and talk to us again as a whole, we will invite them back. That is, okay. So I'm gonna, Joanna, I will compile this to Ann and get it out so that you can look at it. Brooke will put you in on it. Actually, everybody will just put it in. Joanna, you'll have my email address. You can respond if there's anything that needs to be responded, I guess through Ann. And our hopes are that we can get these questions answered for everybody, okay? So thanks for the good conversation, everybody. This is what we're supposed to do. It makes us think and it makes us look at what we're doing with this funding a little bit differently. So thank you, guys. With this, if there's nothing else, I am going to request that somebody.
May I
You may.
make a motion to adjourn?
Thank you.
Second,
Okay, Brooke
Second.
Moore,
Aye.
Bert Johnson.
I second it.
I
Yes.
know, just say aye. Thank you.
Just say
Aye.
aye.
Ruthie.
I don't think
Ruthie?
she's here.
Well, I'll give,
You can put it in chat too, Ruthie.
yeah, that might be best for her. Linda,
Aye.
Joanna Roach,
Aye.
John Balash.
Aye.
Okay, Ruthie says yes, everybody in the chat. Okay, thanks,
We are
everybody.
released. Thank
are.
you.
Thanks, guys.
Thank you.
You're welcome. Talk to you soon.
Bye-bye.